Good evening, ladies and gentlemen. We're live here, Speaking Mind Show. We have a very interesting evening this evening for you, the viewing audience. We have some guests. The BVI Health Services Authority are here with us tonight. And we're going to have a vibrant, live, entertaining, information delivery show. So if you haven't already told one of your friends, call them up, let them know that on JTV Live tonight we're having a real interesting show with the British Virgin Islands Health Services Authority. I have some guests with me. I'll turn to my guests momentarily. I have Dr. June and Dr. Snack here with me. And you could tell the viewing audience good evening, and let's get on with the show.
Hi, good evening, Courtney, and to the audience out there. Thank you for having us on the show.
Good evening, everyone.
All right. So we're going to have a session at first where we're going to have an interactive meeting, and then after that we're going to invite viewers to we'll open up the lines and we'll have them have a conversation with us on the Speaking Mind Show. So we could basically just start by breaking the ice, so to speak, and and anything you want to add, Dr. Samuels, anything that's happening, anything that's new and exciting.
Okay.
Go right ahead.
All right, Courtney, thank you. So tonight we want to talk about a new program that we have launched at the BVI Health Services Authority, which I'm sure that many persons in the audience have heard about. We've recently launched our Telestroke program, and the Telestroke program essentially is a response to a need that we have in the BVI. At the BVI Health Services Authority, our mandate is to develop and bring services to the people of the BVI that meets the needs, our health needs here. And in response to our health profile, we've been talking about this, where within our population we have a significant problem with chronic non-communicable diseases, that is diabetes, hypertension, or combination of both, and risk factors associated with those two conditions, so obesity, or lifestyle, and other risk factors. And as a result of that, what we're seeing in the community is an increasing number of persons who are having complications from living with those conditions over a long period, whether in a significant number of cases the conditions are not well controlled. One of the complications that we've been seeing is stroke, and one of the challenges that we've also noted that's emerging is that the age of persons who are presenting to the Peebles Hospital with stroke, symptoms of stroke, or have completed a stroke, are getting younger and younger. And so, stroke is a condition that once you have a completed stroke, it will leave you with a disability, which makes it difficult for you to function and carry on your day-to-day life. And it's an expensive condition to have, both to the family and to the community as a whole, because individuals who have stroke and are unable to function, cannot function in their day-to-day work life, and therefore they have to be supported in some way, and their families have to be supported. So we thought it was important to develop this program, which would allow for individuals who have a particular type of stroke, we're going to talk about that tonight, to be able to receive that treatment here in the BVI, and by receiving the treatment here, decrease or have, essentially have full or almost full recovery, and therefore they're able to go back to functioning in their day-to-day responsibilities. So that's what we want to talk about tonight. I have with me Dr. Snack, who is one of our internists here at Peebles Hospital, so that we can also do some education with the public about stroke, what it is, how you can prevent it, how it presents, and therefore how you can best use and utilize this new program. The program is being done in collaboration with, we've partnered with HEMA Health out of Puerto Rico. By now, most persons in the public would know about HEMA Health. They are the health group out of Puerto Rico who have partnered with us, and through them we bring specialist services to the BVI that weren't previously available here, that we know that persons would travel overseas to try to access. So the neurologist who would normally provide clinic services here is the person who provides the coverage for this new telestroke program that we're now providing at Peebles Hospital.
Okay. Dr. Snack, do you want to describe the onset of what we call a stroke condition, just so that everybody, the viewing audience get an idea of what we're talking about? What are some of the signs?
Okay, so I think first of all, we should define what a stroke is, because it's important first when we're recognizing it to know what first of all is happening. If we think of the brain and compare it to the island of Tortola and say the water system, we can say that you can have different, main pipes probably going to East End, another set of pipes going to West End, another set of pipes going to, I don't know many places. But anyway, let's just talk about East End and West End. So a stroke really means that the blood supply to a particular area in the brain is cut off, right? So there are two types of strokes. If we think about the water system again, you can have cut off water supply for various reasons. One being that the pipes are blocked, the other one being that the pipes somehow got burst open, got damaged and burst open. Similar situation for a stroke. If you have the first type of situation where your pipes, better known as the arteries in the brain, are blocked with a clot, then that is what we call an ischemic type of stroke. So that type of stroke is a situation where the blood supply to a particular area of the brain is cut off, but it is due to a clot, a combination of a clot and plaques on the wall due to cholesterol, right? And that happens as a result of high blood pressure, diabetes, and high cholesterol, or combination of one, two, or all of the above in the brain, right? The second scenario, which is, you might hear people say, oh, she had a bleed in her head, right? It's a situation where the pipes burst, right? And that situation is where we call a rupture or a hemorrhagic stroke. This is not the type of stroke we're talking about, and we'll understand why. In the first instance, if you want to re-establish flow to that area of the brain, you would want to destroy the clot, right? And then the blood supply would be restored, and that area would then possibly recover depending on how fast you get the blood supply restored to the area. However, in the second instance, you would hope that the body would form a clot to heal the wall and stop the burst vessel. So you don't want to interfere with that clot at all. In fact, it's dangerous to interfere with the clot in the second scenario. So what we have here is the first type of stroke, which is called the ischemic stroke, which is the type that we're talking about specifically. The telestroke program is targeting this type of stroke because we know, according to many studies and what is done at many international stroke centers in the world, that if you come into hospital within a certain time of having seen the symptoms of a stroke, which we'll get to, if you come into hospital in time, we can actually bust that clot, destroy the clot, re-establish flow to that area of the brain, and then the person has the potential of having a full recovery. So that is a very powerful tool that we have available to us, because whereas in the past, what would happen is that the clot would be there, we would give aspirin, Plavix, things that prevent the clot from getting bigger, while giving the body a chance to reabsorb the clot. Because when you have a stroke, that clot stays there and your body slowly reabsorbs it. Just like when you get punched in the face and you get black and blue, everybody can see that after a few weeks, the person is no longer black and blue because the body reabsorbs blood when it's clotted somewhere. It happens everywhere in the body. So because of the telestroke program, we're going to have access to a medication which we had access to before, but now we have access to a specialist coverage. We have access to a neurologist who is an internist who is specialized even further in the brain area, right? And that person is going to be live, available to help assess the patient at the moment that they get to the emergency room, which is not necessarily the same time they would see the internist here. That is that split second, those few moments, the first few minutes when they get to the emergency room and somebody is able to evaluate and say they're having a stroke, then we have that capacity to have the specialist support right away. So that the time, which is the critical point of this, you must get that evaluation and give that treatment within 3 hours, ideally 4.5 hours, 4.5 hours. It can be extended to in some cases, right? You must give that treatment within that time so that it can be effective, because once you get past that time period, it could become dangerous for the patient. Okay? So I think that's the gist of what we would like the public to know. Very important is what you mentioned first. How do we know that somebody's having a stroke? Okay, so we know what's happening in the brain. The blood supply is cut off just like the pipe, and remember, everywhere in the brain controls a certain activity. So there's a part of the brain that controls your speech. There's a part of the brain that controls my movement, right and left hand, right and left feet. So because of that, because we are cutting off blood supply to a part of the brain, whatever area that part of the brain was controlling is going to suffer. We kind of crisscrossed in our heads. So the right side of the brain controls the left side of the body, and vice versa. So
don't let my students hear you saying that.
well, anyway, so that happens for the most part. Let's not get into details. So the point is, we can look at somebody, a lay person, you don't have to be specialized or trained, and determine that they may be having a stroke. We use a mnemonic or an acronym. It's called FAST, F-A-S-T. And FAST means F is for face. So you look at someone's face and you can see that there's something wrong about their face. Some of our grandmothers would, spot a stroke from a distance because they've seen it, in their years of experience. The person's face is drooping on one side. They might be drooling because it may be so weak that they can't even keep the saliva in on that side, right? Somebody may say in some idioms, they say the face lean or the mouth twist. Basically, their face doesn't look the same on both sides. It's asymmetric, right? So that's the facial drooping aspect. That's the F. The A is the arm. So it's easy if you suspect you see somebody's face looking strange, you ask them to lift both arms. If you lift both arms and one falls, right? And you say, lift it up, and it keeps falling, there is a possibility that falling is due to weakness of the arm, and the weakness could be part of a stroke. So that's the arm, right?
Okay.
The S is a speech. So there's a change in the patient's speech, and that change comes from, there could be different reasons. Could be that it's affecting the place in the brain that controls speech. Could be that it's affecting the tongue to the extent that they're not even able to make words, because as we know, the tongue is a vital part of us being able to speak. So F for face, A arm, S speech, and T, most important word, time. Okay, so everybody would love for their relative to get a clot buster and come back to normal, right? But if you don't get there within that time limit that we've mentioned before, 3 hours ideally, 4.5 hours for some people, and I say some people because the criteria changes. If you're in that window between 3 hours and 4.5 hours, not everyone who comes in can receive the treatment, because as I said before, the longer you wait, it becomes dangerous. Right? So if you come outside of that window 12 hours later, no matter how we may want to help get your granny, and as Dr. Samuel was saying, your dad, it may be a 40-year-old, it may be a 35-year-old, and we're seeing those. We may want to desperately, but if you come at 7 hours, it will not be administered because it's dangerous. Right?
I'm gonna ask you something about lifestyle, but I was asking a nurse about the same thing, and the same thing you just said is exactly the same thing she said. She said if you see someone with the slur in the speech, or if you see someone like they're drooling or they can't keep their arms, so I guess it's in the profession. I guess we have to agree that this is a science. That's already
Yes.
established.
Yeah.
I want you to talk to the audience a little bit more about the technology side of it, though. We understand that the technology is here. It's already set up and everything.
Right.
But we need to explain to the public a little bit exactly what happens.
Well, essentially, and that's a question we've gotten a lot actually.
Okay.
What do we mean by telestroke? So basically, it is telemedicine. Telemedicine is not new. It's used in many parts of the world, really, to provide services to a population that may be remotely located and does not have all of the specialist services available. And telemedicine really is the use of the computer and the use of a video camera, and through the process of the internet, essentially, we're able to remotely connect to the neurologist who's in Puerto Rico.
In real time.
In real time.
Yeah.
He would, once the patient presents and we set up the connection, then he will assess the patient along with the physician who's in the emergency room. So they both go through the assessment of the patient together. So essentially it is using the internet via the computer and video conferencing to be able to assess patients. And telemedicine is fairly advanced because the connection, he can see and hear everything that is happening. He will take part in the discussion with the relatives because there's a whole discussion that has to happen. There's a whole consent for treatment if treatment is going to happen. Or if treatment is not going to happen, there's a whole discussion that would need to happen with the family, and he is able to be there and take part in that discussion. And the family will see him. You can actually see him as well. Yeah.
Okay, and the patient can see him as well.
The patient
That's right.
sees him. The patient speaks to both the physician and the neurologist who's who would be in Puerto Rico at the time.
I've seen something done like this with a knee injury, where they had a camera up inside of the knee, and both doctors were discussing how they were going to repair the ligaments.
Right.
So that might be different from what you're talking about. It's the same technology.
Well, it's the same technology. It's the same concept.
And if this is the beginning, I am hoping that you tell us that more is going to come.
Well, definitely more is to come. This is the
Okay.
beginning. Telemedicine is something that at the Health Services Authority we've been talking about for a few years, and it is a form of service that would be really useful for us here in the BVI because we have islands remotely located, right? And we have services on all of those islands. So it is in the discussion of how we integrate the services and have some of the specialist services that are on Tortola available to, for instance, Anegada, Virgin Gorda. And telemedicine is a facility that we can use to be able to do that. And it is we are having those discussions at the moment.
Okay. But you would need reliable internet service.
Of course.
Yes.
Of course. And I mean, we have with the telestroke program, we have been able to acquire the well, I don't know all the jargon around the internet, but around the internet, the specifics of the broadband width and all of that. But there is a particular broadband width that is needed that we've been able to acquire because as a part of the service, what also happens is that a CT scan is done, and the CT scan images have to be seen by the neurologist.
Right.
Okay, so those images are uploaded for him to review, because all of that is taken into consideration in making the decision about whether the patient gets the treatment or not.
Okay. Sounds like a lot of technology involved, and I would agree with you. Once there's that, what we call a handshake, in the technology world.
Yes.
Once you have that good handshake, where data can flow back and forth.
Back and forth.
Yeah, that's the key. That's
Yes.
the key
Yeah.
element.
Yes.
You
Yes.
know, to ensuring that it happens. Well, sounds like great news. The only thing I would ask you, I know that you've been making a lot of agreements with a number of institutions to supplement the services that you're offering. So, as you make those agreements, you look at the telescoping aspect of it. as
Well, telemedicine, yes. I mean, and telemedicine is one of the ways that we can use to bring the various services. You know, there are many specialties. I heard, you know, I was listening to the radio earlier today on another talk show, and I heard, you know, the concerns being expressed there about specialist services available in the BVI. You know, in making specialist services available to our population, which is, you know, maybe about 35,000 people, there are certain specialties that you will not be able to support on the ground 24/7, 365, because you don't have the volume in terms of the number of persons to support the specialty. But, you know, we can make certain types of specialty services available through various agreements and through using the technology. So all of those considerations are what we are looking at in terms of expanding the scope of services that we want to make available to the people in the BVI.
Okay. Sounds great. Yeah, it sounds like we're going to be able to provide services that we weren't able to provide in the past, you know, pretty soon.
Well, we're in the process of doing that. We've
Okay.
started, and so it is an ongoing process of expanding the scope. Yes.
Dr. June, Dr. Snack, we've been asked to take a break for the sponsors that make this show possible. So we're going to take a break and we're going to be right back with you.
Police have gone right at the last left turn, you know.
Bridget, the directions I got to go straight.
Oh, you go and tell me about them stupid directions when the map is right here.
Let me see the map. Let me see the map.
So now you want to see the map.
Give me the map, man.
Alright.
No, we passed there already.
Oh.
Make a right, go 100 meters, and that's the destination.
Having Digicel data is like having the fastest man in the world save you from getting lost. Start using Digicel data today. Digicel.
Many people don't even know that they have cabin filters in their vehicles, and most others aren't aware of the health benefits of maintaining your vehicle's cabin filter. Dirty or clogged cabin filter can cause musty odors in your vehicle and cause contaminants to become more concentrated in the cabin that passengers actually breathe more fumes and particles. The cabin filter helps trap pollen, bacteria, dust, and exhaust gas that may find their way into your vehicle's air conditioning, heating, and ventilation system. The filter also prevents leaves, bugs, and other debris from entering the HVAC system. Change your cabin filter. It's a simple preventive maintenance step that goes a long way forward to protecting you and your passengers, as well as your vehicle heating, ventilating, and air conditioning HVAC system. Breathe easy, Virgin Islands, and get your cabin filter replaced today. Visit One Stop Auto at the R&R Malone Complex at Popwood Pond, or call us at 495-2886.
I'm here to find out about my husband's social security. You hear about that bad accident?
Yes.
This my husband get my shop.
He went to Puerto Rico.
Yeah, it was a serious accident, you know. But he won't get some of that security money.
Miss, your husband's contributions are not up to date.
What? What do you mean by that?
Remember, you must secure your tomorrow today. Check on your contribution status right away.
Littering is a criminal offense under the Littering Abatement Act. Our litter wardens and police officers are hunting for litterers. You will be caught when you least expect. Litterers are subject to a $500 fine or 3 months in prison. Stop littering in our country. You are hurting our environment and you are hurting our economy.
Cheers to a month of mouth-watering events. Join us this November for a series of exciting culinary experiences such as the Barefoot Gourmet Soiree, with proceeds donated towards hospitality scholarships for local students. Or experience an evening with our participating hotels, hosting visiting chefs from around the globe. Join our Restaurant Week cook-offs and sample special discounted menu items. Every Friday of the month, our chefs prepare savory local dishes. Head to Virgin Gorda for the first ever On the Rocks bar crawl. This food-filled month climaxes on the Drowned Island at the 2nd Annual Anegada Lobster Festival. Visit www.bbifoodfet.com or call the BBI Tourist Board at 284-494-3134 for more details.
What kind of party this?
Them they bring the music.
Seriously?
Having Digicel data is like having the fastest man in the world save you from party disasters. Start using Digicel data today. Digicel.
Yes, ladies and gentlemen, right back with you after a short break. We were having some real discussion and we're going to get right back into it. Dr. June and Dr. Snack are here from the BVI Health Services Authority, and they're putting it on the line. They're giving us all the new information, the new technology that's right here, right now for People's Hospital. So we're going to continue talking a bit about service. We were talking a little bit about preventative care, or although we know things like this happen, but
Right.
there are things that we can do in a society in terms of changing our lifestyle, in terms of being more proactive and being motivated to take care of ourselves. So you want to talk about that a little bit?
Well,
as it relates to although we're going to have these services, but at the same time, costs, availability, everything.
Right. Well, I guess I'll let Dr. Snack go first.
Okay.
Well, of course, many of these complications, as we know, are due to underlying illnesses, hypertension, diabetes, and high cholesterol, just to name the main culprits.
Okay.
So for all of these, we have some factors are what we call modifiable, things that you can change, and others are non-modifiable. So for example, if you have a family history of diabetes, hypertension, there are certain things you can't change. You can't change your family history. You can't change whether you're male or female. But what you can change is your lifestyle. And unfortunately, that is sometimes the most challenging thing to change. However, when there is actually a change that is effected in someone's life, we do have proof and evidence from various studies that show, for example, that you decrease the chance of developing hypertension, even if you have a family history, just by decreasing your salt intake and increasing your exercise, right?
Okay.
So that's one thing. Decrease your chances of going from somebody who has what we call impaired glucose tolerance, or some people might say, the doctor told me I had a touch of sugar, but I don't have diabetes yet. They like to say that. But it's not diabetes yet. You may be able to prevent yourself from ever developing diabetes if you catch yourself in that gray zone and institute some changes in the lifestyle. And by these, we talk about cessation of smoking. Smoking is one of the major risk factors for both stroke and heart attack, right? And that is something that we can change. As hard as it may be, there is support for cessation of smoking, while we may not have all of the human resources that we need, it is important that we encourage persons, whether it be through the support of family, church, friends, and so on, to have that sort of psychological support to make that life-changing decision, because we know that it's going to decrease the long-term complications, such as what we're talking about today. Right?
If I might interject, that is also a community effort, because we know we have the legislation in place, right?
Right.
For smoking and
in
no
public
smoking in
places.
public
That's very
places.
true.
Right.
We have that in place.
That's very true.
And I've recently heard that in the UK they're banning advertising at sports functions, and they're also reducing the size of the label on the package,
Right.
and they're increasing the size
Surgeon
of
General
the
warning. That's
Surgeon
right.
General information. So
Right.
maybe that might trickle down to our community one of these days.
Yes, we hope so. We hope so. There are other things that other countries are doing, increasing taxes.
Increasing
on,
taxes, that's
on
correct.
tobacco, for
That's
example,
correct. Yes.
right?
Sin taxes.
So
Yes.
we need to do things as a country and as a community, as you very rightly say,
Yes.
that is going to influence our productivity in the long term, because people don't see it that way. But every time a 40-something-year-old man or woman becomes incapacitated or debilitated because of a stroke, heart attack, or any other complication, kidney failure, which is another, we need another day to talk about that one. Right? When you become incapacitated because of those, it affects the country's productivity. We have to see it as the entire country being affected as opposed to just a person. Yes, it affects the person, it affects their family, and so on. But in the long run, the entire country is going to suffer, not just financially, but in terms of the human resources,
Right.
Right. And that is important.
And that's one of the things that I often say, when I've been speaking in the BVI, our greatest resource is our human resource.
That's so true.
Okay, and so if we are right now, we have concerns about secondary age school children who are having blood pressures that are over and above what they should be in that age group.
Okay.
So if we're starting at that age with seeing elevated blood pressures, we know that we have diabetes in our school age population as well. That doesn't bode well for us as a community in the long run.
Yes.
So it's going to affect the very resource that we need to keep the country as prosperous as we would like to think that we are, because that depends on our human resource being able to function and be productive.
Well, the health of a nation, has to be the health of the human
Exactly.
resources of the nation.
Exactly.
That's true.
And what we need is for each person to take personal responsibility and take this on, as a challenge, as a fight, because most of us have a relative, or we know somebody who has diabetes, hypertension, probably both renal disease. We know we obesity. Dr. Snack didn't mention obesity, but obesity is one of the risk factors. And if we look around in the community, we know that the community has gotten larger over time.
Yes.
Okay, so obesity is one of the major issues that we need to talk about as well. Or consumption of sugars, that's my new pet peeve, right? Because you know our cultural foods, Courtney, right?
There was a doctor from Bermuda who really gave me a wake-up lecture. She took us a bunch of those little sackets of sugar, and she piled them on the table, and she said, "This is how much is in this this soda."
Yes.
And I think that. For me, that
kind of took it home for you. Yeah.
To realize, I wouldn't put that amount of sugar in a drink.
Exactly.
So why are we, consuming that amount? That amount of sugar?
And going back to the community, some schools have actually instituted a no soda policy.
Yes.
So they want the students to bring in water, they want them to bring in other types of beverages, and they just don't allow sodas in the school. And it's a drastic measure.
Right.
But if people see the long-term effects, then we might see our children.
I think in some places too, they ban the oversized
Yes,
That's
in,
right.
in some in the
Yeah.
US,
In the
they've
US,
started
That's
looking
right.
at decreasing the size of the drinks.
Yeah.
Portion control,
Portion
portion
control.
sizes,
Yes.
Right.
And
you
proper
know,
labeling.
and proper labeling,
Yes.
right? So,
that's another
so
thing.
those are some of the preventative things that, and you know that some of these things have to be looked at from a national perspective.
Yes.
All right. So there are some of these things that we would want, for example, the government to make policy on,
Yes.
because I think if leaving it up to individuals to have to do some of these things on their own, you may not see the effect that you want to see as a whole in the population, right? So there are some of these things that need to be tackled using public policy. But in the meantime, each one of us has to take personal responsibility for our health and actively engage in prevention.
Yes. And while we're talking about that, and especially talking about the obesity side of it, we have the trans fat and all these other things that are, become kind of like everyday.
Yes.
For some of the kids. I'm talking about the type of food that they're actually eating. The
fried foods.
Yes.
The fried foods and the fast
The French
food.
fries.
The things that are easy to prepare.
Yes.
And
all the packeted things that are frozen that we put in the microwave.
Yes.
Right. All the things that are in the middle of the supermarket in the tins. Yes, those kinds of things.
And we might be just talking about it, but I don't think some of the people might understand that these are some of the contributing factors to the conditions that you're
That
describing.
is absolutely,
Yeah.
absolutely.
Yeah.
So Dr. Snack talks about your salt intake, and in the past we've said, we used to say, no added salt, right? So
Yeah.
don't add salt to your food after you've cooked. But now we're going a step further, and we're saying you actually need to look at the sodium content in your foods, right? And if you're taking it out of a tin, chances are
It's high.
the sodium content is high.
It's already
Yes.
there.
It's already there
Yes.
because it is part of what has to be there for
Yeah.
preservation.
But I want to go back because it's not just after you eat.
Right.
It's while you're cooking it too.
Well,
while
true.
you're preparing
Sure.
it, because people tend to sprinkle quite a lot of salt during the whole process of cooking and preparing, and some people will say that it has no taste. And I encourage patients to use green seasonings.
Yes.
Not the ones that are in a bottle preserved, because these have sodium too.
That's
the
right.
ones that you prepare at home, the
Grow in the
garlic
backyard.
and the green onion, parsley, celery, etc., that you can put in
Peppers.
food. Exactly, peppers to give the food taste. And another trick, well, not a trick, but I tell patients too, our bodies are amazing. We adapt to anything. So if you are used to adding 2 tablespoons to your chicken when you season it, don't be drastic and shock your taste buds. Decrease
Gradually
it
decrease.
to 1.5.
Yeah.
Your body will not notice. And then decrease it further to 1. It's amazing how you can fool your own self, and your family. Remember, you can't cook for yourself and your family. That's one problem a lot of hypertensive patients have. Like, I can't prepare 2 meals, my husband won't eat it, my children won't eat it, or whatever. Don't worry, adapt. The whole family adapts together
That's right.
and adopts the healthy lifestyle together, because at the end of the day, everybody has a risk factor.
And don't wait until the problem is already there. Start now.
Yes, definitely.
Yes, because Dr. Snack could also probably talk about, some of the studies talk about when we actually make the diagnosis. So, for example, with diabetes, by the time you get the diagnosis of diabetes made,
Yes.
there's some studies which suggest that those changes have happened in your body probably 5 years earlier.
Yeah. So some persons, when they're diagnosed, may have been diabetic 5 to 10 years before. They
Right?
actually
So,
get
and it is at that point that the changes start to happen.
Right.
Okay, so you're now 10 years trying to catch up on some of the the changes towards complications that have already started to happen in your body by the time the diagnosis is made. So that's why it goes back to something Dr. Snack said about knowing your family history. It's important to know your family history, and it is important to have a risk assessment done, because you need to know what you're at risk for developing. And therefore, if you know what you're at risk for developing, you can start to institute those preventative changes early.
And if I may add, know your body.
Yes.
Yes.
Because if you know your body and something is happening to your body, you can go run for help.
Exactly.
Yes.
Right.
But unfortunately, while that is true, some people will never pick up the signs.
Yes.
And some wait for signs. And I tell patients all the time that hypertension is happening and you have no clue.
No clue.
So
That's true.
we have had persons
Silent
walk
killer.
in to the emergency room or to a clinic just to check because they happen to be passing by.
Yes.
And when we check, their blood pressure is 250 over 160, and they were quite chilly.
Yes.
Chilling with the blood pressure that high. So while it is true, I think we need to stress the need for having a yearly checkup. It's just healthy. Have a general practitioner, even if you have no illnesses whatsoever.
You
Find a
go
general
and
practitioner.
have a checkup.
See somebody regularly, so that when you happen to get into the gray zone of between hypertension and normal, which we call pre-hypertension, somebody will pick it up before you get to hypertension.
But
Right?
you know, too, the Red Cross and the Rotary Club, and they have annual screening that
There
they,
you go.
that they put on for free.
There you go.
But
And
one of
some
the things,
people don't go to them. Though. That's the problem.
right? But one of the concerns that we've had coming up out of those types of health screenings, though, is that we're not sure how many persons are actually following through.
Okay.
Right? Because
Okay.
there are a number of persons who would go to the health screenings and get told by the nurse that, you know, your blood sugar is higher, your blood pressure is borderline, but you need to follow up with your physician.
yes.
And we're not sure. So that seems to be one of the gaps in the system that
Yeah.
you know, we've been talking about at Health Services Authority about how we can bridge that gap.
Capture those.
Yes, to capture that group. Because Dr. Snack talked about doing your annual physicals.
Yes.
Yeah, because in total, you know, we only go to the doctor when we're feeling sick.
That's right.
Okay? And
Everywhere,
that's
not
what
just
we
in
want
Tortola.
that particular behavior to change. It should be something that we do routinely. You know, if we have children, as adults, we get into the practice of doing an annual physical.
Well, that's something that we'll have to stress more and also bring on board the insurance companies.
Well, true.
To ensure
For most of the insurance plans, though, they do cover you doing annual physicals.
Yeah.
Okay, so if you have insurance, it would cover it. Under National Health Insurance, which will probably roll out sometime next year, it would be covered that you do an annual physical.
Okay. Well, it is important to have that evaluation to go on. But since you started talking about that, we want to talk a little bit about the health services system, the file storage system that you have on board now, where you can pull up stuff at the various locations.
You're talking about our electronic records?
Yes.
Oh, so our electronic records, basically that's one of the initiatives that has come on board probably a little bit more than a year now.
Right.
And the purpose of that really is to improve access to patient information for the healthcare practitioners,
Right.
and you know, as for patient safety, because it allows us to see at any point at any of the clinics patients, the visits they've been having, medications they may be on,
The history.
and their whole history. So it allows us to have, for each patient, they have one record, and you know, the implementation is ongoing because it's evolving over time as we expand the modules within the system.
Okay. Sounds great. Sounds like we're moving along.
Well, we are moving.
Mm-hmm.
We are moving, and you know, we're transitioning into the new facility as well.
Yes,
so that's something that is,
And I
we're
heard
quite busy doing.
And I heard on the news today that the pharmacy wouldn't be open on Monday because it's a holiday.
Well, not because it's a holiday, no.
Well, it's a
But
holiday.
it's a holiday.
Well, it's not gonna be
They're
open
going to
on
be
Monday.
open only to the inpatient services
on
on Monday.
but they'll be
Yes.
back to regular
Yes,
on
on
Tuesday.
Tuesday. Yes.
See, information is very important to our viewers out there.
Yes.
We got a couple of texts. Let's see what people are texting us and saying on the show. Good night. I suffer with high pressure for 2 or 3 months. It 156/98. 2 days ago, it was 184/106. What must I do? I am a diabetic. I have
diabetes.
I am a diabetic. Doc?
Okay, well, as you said, you suffer with high blood pressure. We would have to have a discussion because, of course, my first question is, are you taking medication regularly? Have you seen a doctor? Is this self-diagnosed? Is it that you went somewhere to check your blood pressure and it was high and you now know that you have high blood pressure, or did a doctor diagnose you with high blood pressure and put you on medication? If you are on tablets, then it means that some adjustment may be needed to those tablets. Because remember, the whole point of starting medication is to see how your body responds to it and then add more medication or increase the dose as needed. So there's a reason why we give prescriptions for 2 months or 3 months. It's not just because we want people to come back and give them trouble. It's because we need to assess whether the medications are actually doing what you would like them to do and make adjustments to that. The fact that you have diabetes, remember, these two diseases like to travel together and they are like double trouble. Okay? So the fact that you have diabetes makes us even more concerned. We don't even want your blood pressure to be anywhere above 130/80, at least definitely not above 140/90. So these numbers are too high, and what I would suggest you do is that you see your doctor as soon as possible, meaning Tuesday, because I'm sure nobody's working tomorrow and Monday's a holiday, so Tuesday, and try to see if you can get those things looked at as soon as possible.
I got another text that came in. We might have to ask for some clarification. It said, good night. What about those thin stuff that mark no cholesterol?
That's probably the foods,
Yes.
the packets of
Yes.
foods that say no
Yeah,
cholesterol.
Remember I said labeling, right?
Yes.
Right, so
it's
that's
a lot
one of the
false
moves.
labeling going on, and you have to be careful that you don't read it for what it says, but really check to see what the ingredients are, if you
Yeah.
can.
If you can, indeed.
And the labeling, labeling,
It's
you have to
inconsistent.
be careful with labeling.
It's
So you
inconsistent.
actually need, even though it may say no cholesterol, you need to read the packet because you want to know what the fat content is.
Right.
You want to know what the sodium content is and what the sugar contents are. So because a packet says no cholesterol, really in effect doesn't really mean anything.
That is safe.
Right.
I
You
got
still
another-
have to read the other.
I got another text. What other services are provided by HIMS?
HEMA, I guess.
That's probably
I wanted to
HEMA.
say.
HIMA?
So the other specialty services that are provided in the collaboration with HEMA are pulmonology, which is a specialist who looks after diseases of the lungs. So if you're asthmatic or you have obstructive lung disease, that person would see those types of patients. We have, I said neurology earlier. Cardiology, we have a cardiologist who comes over. Oncology, which is cancer specialist, and that person also deals with diseases of the blood. They're hematologists. And we have a rheumatologist. A rheumatologist is a specialist who deals with diseases of the joints, arthritis,
Nephrology.
yeah, and fibromyalgia, those kinds of conditions. And then we have a nephrologist who comes over to provide services to the dialysis patients.
Okay, I have another text that came and said, good night, guys. I always drink a glass of water or two whenever I eat something salty or sweat. I really believe it helps with prevention of diabetes and pressure.
Okay, water is good. However, water has not been shown by any studies to prevent high blood pressure or diabetes. We spoke about modifiable and non-modifiable risk factors for the development of these diseases, and some things you can change and others you can't. So we spoke about the family history, your age, for example, is more common in men older than 45, women greater than 55, for example, heart attack.
Okay.
So while I would encourage you to continue drinking water, I would not encourage you to believe that it's going to prevent high blood pressure or diabetes. We would still encourage you to see your physician at least once a year if you are not known to have any disease at this time, and so that you can have a complete physical and pick up any abnormalities before it's too late.
Yeah. And if you're eating something salty and you drink the water, it doesn't cancel out the effect of the salt thing that you've eaten, because what will happen is your system will now try to absorb more water, and you push your blood pressure up. Okay, so it doesn't cancel out the effect of the salty thing that you've just eaten.
Doctors. One person texts back and say, okay, I will see my doctor.
That's excellent. Excellent.
Well, at this time, as usual, the persons that make the show possible is asking us to take a break. So we're going to take a break and we're going to be right back with you.
Place spaghetti in boiling water, add tomatoes, sweet peppers, and onion, and presto, you have spaghetti marinara.
Having Digicel data is like having the fastest man in the world save you from last-minute dinner dilemmas. Start using Digicel data today. Digicel.
Many people don't even know that they have cabin filters in their vehicles, and most others aren't aware of the health benefits of maintaining your vehicle's cabin filter. Dirty or clogged cabin filter can cause musty odors in your vehicle and cause contaminants to become more concentrated in the cabin that passengers actually breathe more fumes and particles. The cabin filter helps trap pollen, bacteria, dust, and exhaust gas that may find their way into your vehicle's air conditioning, heating, and ventilation system. The filter also prevents leaves, bugs, and other debris from entering the HVAC system. Change your cabin filter. It's a simple preventive maintenance step that goes a long way forward to protecting you and your passengers, as well as your vehicle heating, ventilating, and air conditioning HVAC system. Breathe easy, Virgin Islands, and get your cabin filter replaced today. Visit One Stop Auto at the R&R Malone Complex at Parkwood Pond, or call us at 495-2886.
Turbo Plus, the refreshing family drink with a herb fruit flavor.
New flavors now available: mango, pineapple ginger, and soursop. Turbo Plus is distributed in the Virgin Islands by Total General Services.
Hi there, welcome to Botanic Service Station, your #1 Soul gas fill-ups in the British Virgin Islands. Try our delicious hot wings or pizza with your favorite toppings, made fresh every day. Try it, I know you will love it.
Need a cold drink? We have the widest variety, the cheapest and coldest in town.
Just a friendly reminder, we have a wide range of vehicle maintenance products.
Oils, coolant, batteries, air fresheners, and our #1 product, Soul Gas. The best gasoline that will take you further and keep your engine running cleaner. Do you love to cook? We have your LPG right here for your convenience. Open from 7 a.m. to 11 o'clock p.m. chances are you'll be stopping by the Botanic Service Station today. So just grab a cold drink while you're there.
Alls Marine Air Conditioning and Refrigeration specializes in servicing and repairing units such as Daikin, Marine Air Tech, Mitsubishi, TGM, York. Any type that you call, we can install. We also work on commercial and residential units in houses, boats, cars, and company buildings. If you even need some cool breeze for your doghouse or horse stable, we will not hesitate. We are always able. No job is too big or too small for Alls Marine Limited. For our home and restaurant customers, we also service and install all your appliances such as ovens, stoves, washers, dryers, refrigerators, and freezers. You can contact us at 494-4529 or 340-3791 or email us allsmarine@bvi.com. Alls Marine is located in Purcell Estate Road, Town, Tortola. Alls Marine Limited, your number one choice.
Last left turn, you know.
Ready? The directions I got to go straight.
Oh, you go and tell me about them stupid directions when the map is right here.
Let me see the map. Let me see the map.
So now you want to see the map.
Give me the map, man.
Alright.
No, we passed there already.
Make a right, go 100 meters, and that's the destination.
Having Digicel data is like having the fastest man in the world save you from getting lost. Start using Digicel data today. Digicel.
Website and stuff like that.
Ladies and gentlemen, we're back with you after a short break, and we're joined by another healthcare professional. Sandra, Franca, you want to introduce yourself?
Sure.
Right.
Thank you for having us. My name is
You're
Franca
welcome.
Potter, and I'm the Marketing and Communications Manager at the British Virgin Islands Health Services Authority.
Okay. A person I know for a while.
You have known me for a while, yes.
Yeah, you're gonna tell us about some of the new things that are happening as well?
Sure. We have quite a bit happening in health services. One in particular, as we all would have known by now, if you're living in the BVI throughout the Caribbean and you receive some of the radio programs that we have and the information that we provide, it's a pledge program.
Okay.
The pledge program was developed to assist in outfitting the new People's Hospital, and a lot of effort and initiative have gone into it to help raise funds in very creative ways. And as early as tomorrow, we have the Caribbean Insurers and BVI Motorsports Soapbox Derby.
Yes.
It's quite extraordinary. I was able to see, I was passing in town today and I saw CCTs. They were building theirs. They were actually finished painting it. I saw last year's Miss BVI, what's her name? Chichester, Rosanna Chichester, and the whole group, it was about maybe 15-20 people painting meticulously the signs and the fire on their go-kart. And I've seen the one donated by STO Dion Stout's company to one of the schools, and of course health services have ours. We are planning to win. I also took the time to go up to the college today and I saw the ramp.
Okay.
It's about 10 feet high. It seemed kind of scary to me, but I think young boys and men would love it. So that's kind of exciting. So we really want everyone to come out to that. It's an extraordinary opportunity to have a family activity. These go-karts were to be built with family members involving the children. Even the one with the CCT I saw today, there were children out there. But you could see it was a brainchild of the adults. These activities that are going to be coming on stream in the next coming weeks, as I said, as early as tomorrow, Sunday, at 1 o'clock up at the college, is to help provide funds to the New People's Hospital. The outfitting to help purchase equipment, help purchase beds, help purchase operating tables, supplies, incubators, you name it. That's where all the money will be going for the new pledge program. Next week, on November 1st, we have an inaugural walk. That one is being championed by Scotiabank. It's a run walk. It's taking place the walk is 6 o'clock in the morning, and the run is 5:45 in the morning, and we're asking everyone to be there from 5:30. That's so the teams can gather. You can get t-shirts. There'll be giveaways for the first 200 persons. Quite a number of companies have donated, whether it's Gatorade, water, drinks, towels, paraphernalia, company items. And the hospital is also going to have a health tent. Under the tent, and we're going to have one tomorrow as well. Under the tents, you can get your free blood pressure and glucose monitored, as well as brochure and information. There will be a nurse there that you can ask questions to, like your wonderful people who were calling or texting in with some medical questions and concerns. You will have medical practitioners there at your fingertip to ask. So we really want the community to come out, because this is the community's hospital. We can't say it enough. It's not just we're not being cliche or just asking you to contribute to your money. In this time when the global economic crisis, we are starting to really feel it here in the BVI. A lot of companies have left. The quote unquote high earners have left or have been merged. So you have people, CEOs, performing the job of 3 or 4 employees, where in the past you would have had many different employees. So a lot has changed. A lot has changed in the world over the last 5 to 10 years. And we cannot expect things to function the way it used to when the bank accounts were full and overflowing. That's not the case. And for health services, when we really say the New People's Hospital Pledge Program is to provide and to support the community, to make sure that you don't have a state-of-the-art facility and you have mediocre equipment. It's to make sure that what is needed to provide optimum service is available, and that's what these fundraisers are for.
Okay. This may be a little bit off, but I was just thinking while you were saying that we also need to look at the maintenance side with the technology, with this new equipment, to ensure that somewhere further down the line we start, getting those technicians, up to speed. Dr. June?
Well, the hospital is required to have one of our long-term, probably medium-term goals is to have all services accredited.
Okay.
And as a part of that process,
the accreditation process.
Yes, as a part of that process, and as a part of the process of bringing in all of this this new equipment, we're required to have biomedical technicians and facility managers who have the responsibility for maintenance and upkeep, maintenance of the facilities, upkeep of the facilities, and of the medical equipment.
Because some of this high technology equipment is very sensitive.
Yes, it is. It is, and it's a specialty area.
Yes.
We have one, a BVL and on staff right now who's a trained biomedical technician, and we also in collaboration with Baptist Health, and as we get new equipment in, their experience is being expanded, and they, so that they get the training, the necessary training,
transfer of technology,
to be able to manage the equipment.
Very good.
Yes.
Very good.
So that's required.
Okay. So we have a number of programs that the BVI Health Services Authority is bringing on stream right now. That's good.
It's ongoing. It's really ongoing. And one of the tasks that I'm charged with is to make sure that the public get as much information as possible as soon as possible. We have quite a bit of internal communication because we take pride in making sure that we are ready. on the inside. We are trained on the inside. We are prepared on the inside first, and then we are prepared to share the information as it become available to the public. We had on September 1st a website launched at www.bvihsa.vg. On the website you will find a list of all of our services, our specialty services, our partnership services, as well as a complete portfolio of our executive team. We have a call?
No, we have a text that came
Okay,
in.
you want to go ahead, or?
Yeah, okay, it said, hello Courtney. Please tell the nation what is being done with the high cost of healthcare in this country. How will the small man will survive? That's a question.
That's
for
a
Dr.
concern
Zhang.
that I think that all of us who are in the healthcare field have, and I know it is a concern of the Minister of Health as well,
Okay.
because healthcare costs are not just high in the BVI, healthcare costs are high everywhere in the world.
Right.
The whole thing about Obamacare in the US is really about trying to put a system in place that allows the small man to be able to access health care. And just so in the BVI, there are a number of initiatives that are being looked at to ensure that the small man is able to access care, because that is key. Everybody must be able to access care, and everybody must be able to access quality care. So right now we have a situation where there is inequitable access to care, because currently only 30% of the population has insurance. Okay, so the other 70% who don't have insurance either choose not to access care too late, or we pay for them in various ways. Okay, all of us are paying for them now. So the aim is to allow to put a system into place that allows everybody to be able to access care, and that it doesn't become unaffordable for one individual. So that's a concern that all of us have. I mean, nobody has it. I don't think anybody has it more than those of us who work in the field, because we know what healthcare really costs. Okay.
And also, I just wanted to add that until NHI gets fully rolled out, there are payment plans. We don't want anyone to think that that quote-unquote small man frame is a reason why not to come to the doctor.
Right.
A healthy population is what builds a nation. And if you are home because you think, okay, it's either rent this week or it's my tablets or something, the hospital will put you on a payment plan, as low as what you can possibly afford. The adjustments would be made, because the goal is to have a healthy community. And the services, we have to remember, especially in a public hospital, the services have to be paid for. Electricity has to be paid for. Water bill has to be paid for. When these overhead bills come in, and these are outside the services we provide, supplies, gauze, gloves, I mean, it's an overhaul of so much. I call it like a very complex web of things that make the unit function. But at the end of the day, the real purpose is to have a healthy community. A healthy community, whether rich or poor, young or old, it's to have a healthy community. And that's why we're asking again, those who can afford to say, I can write a check for $5,000, and while I don't think anyone would want to just throw away $5,000, but if you can afford it, if you can sincerely afford it, it is worth the investment, because you're invested in the health of the people. If you can afford to just give $1, if you can afford to give $5 or $10, it will be accepted with the same level of appreciation. So, if health comes first. Health comes first.
And I think too, it goes back to what we were talking about earlier too, Courtney, that we know that healthcare costs are escalating. And that's why prevention is so important. And that's why each one of us, we have to be our own champions for prevention. And everybody has to take on the responsibility to actively work towards So, I mean, you were talking earlier about meals in schools, for example. We can look in the community and we can see where the unhealthy practices are. Okay, what are we willing to do about it as a community? Because at the end of the day, that is where it starts. We have to champion for a healthier community and for healthier practices across the board. Okay, because if we don't do that, our healthcare costs will continue to go up because we will be fighting with the complications of unhealthy living.
I have one question I want to ask you, a little controversial. The Ebola crisis, preparedness for the Ebola crisis, frontline workers.
How did I know we wouldn't get away from that?
It's what's happening right now.
Because one of my fellow officers specifically asked me to ask the question. He said, we're on the front line. We're the first people that are going to meet people and meet and greet. And he just put his hands up like so. He said, we're not prepared.
Well,
it's going to take training. It's going to take equipment. It's going to take policy. It's a lot of work.
It is a lot of work, and the process of preparation is ongoing. You don't stop. We don't stop preparation. What is happening is that we are in a heightened state of awareness because of the fact that Ebola is now right next door to us. Okay. But, for example, at the Health Services Authority this week coming up, there's a series of trainings that will be happening. We have an infectious disease specialist who's coming in from Barbados who's going to be doing some work with the staff there. We started training last week with the staff. And really it is about working in health services. It's about working with the staff to have persons be consistent in the practices that we should be engaging in anyway. Because when you come to the hospital as a patient, any patient who comes is potentially infectious, and we're supposed to be practicing universal precautions anyway, right? So it is about strengthening that within our staff. For persons who are in the front line, the border control, I know that the Ministry of Health has been working with those agencies and working on identifying where the gaps are and providing the necessary resources and training. So I'm sure that, we're going to be hearing more about that from the Ministry of Health with regards to, because nationally there's activity that's happening in terms of preparation in the event that you had a case of Ebola. Well, but certainly at the Health Services Authority, we have to have a plan, and we that work is ongoing work.
The worst thing is that for people to be scared, or people to have misconceptions.
Absolutely, yeah.
And lack of information does that.
Yes, yes, we agree.
So,
okay.
Well, I think the time is going by really quickly. We have the numbers up there, 300-1949 if you want to call, 300-1950 if you're going to text. Well, I think we had one other text that I didn't read, Dr. Samuels. It says, really? Payment plan? When did that start? Because you have to come up with the down payment, and before you leave the hospital, you have to pay the balance. That's a text that came in. So.
No, I can look into that. I know up until recently I had a conversation with the CEO, and it was very clear, very clear. That
process,
it's been a while.
That process has been in place for a while.
See, the billings and admissions, sorry to cut you off, Dr. Samuel. Patients have to realize that there's like if you go to a store, for example, and we know certain stores here in the BVI, we go in, it's $90, we take out $90, we pay and we leave. Then there's other stores that we know, we're told $90 and we say, $90? Come on, you can give it to me better than that. And they'll come down to, let's say, $85, And I'm not saying that the hospital functions in this negotiation type of way, no. But there is room for payment plan, because if you're sick, you're not going to be turned away and said, you know, you can't pay, so go away. And we've heard, you know, some of the concerns. We've investigated some of the claims, right, Dr. Samuel? And up until recently, when I spoke with the CEO in reference to the same thing, there is a payment plan at Billings and Admissions. And should a patient present and say, I am not in the position to pay this bill in full, I am not in the position to pay half, they will be asked, what are you in the position to cover? What can happen to make this bill settled? So yes, payment plans are available.
I think I have one other text here. What are the special services?
No, that did that one already.
Then he did that one already.
What about the insurance?
The one about insurance. We should make sure healthcare is equal for all. That's a text that came in. Enjoying the discussion, very informative. Thank you. That's what we're here to do. We're trying to reach the community and make sure that the community have information, valuable information that can help change our lives, help change our lifestyles, help give us better health care in the future.
Yes. And the thing about healthcare being equal for all, that is a process basically that refers to standards. Okay, and you know, going through an accreditation process forces us to put standards in place so that yes, the care that everybody gets that comes through the door would meet criteria and meet standards.
And
so that's a work in progress. That's ongoing work.
And must be verifiable.
Right. Well, evidence-based.
Evidence-based and must be verifiable.
Yes.
Yeah. Well. Okay. Sounds like the same language. But that's good to know that that we're aiming that high, because you know if you aim high, there's an old saying: if you aim high, even if you fall, you wouldn't fall too low.
Well, we're aiming high. We're aiming towards excellence.
That's good.
That's where we're headed.
And just to sort of recap, we Dr. June, you've been here with me all the time, but we started out with telescoping, and we went into a number of the services that you're rolling out and offering, and we went into the new areas that Franco was talking about. The soapbox stuff that's coming up.
Derby tomorrow.
Tomorrow
at the college at 1 o'clock.
HLSCC at 1 o'clock. Right where the palm trees are located on the
that's the ramp.
main entrance. That's the ramp right there. So again, everybody come out, bring the whole family.
Yeah. I went up there. Some tents are up, chairs are there. There's going to be food, a bouncy castle, face painting. I mean,
it's a family affair.
Yep.
A whole family affair.
A whole family affair. Of all ages, and I think it'll bring back out the kid in all of us. Yeah.
Great.
And it's all for a good cause.
Yes. It is your participation in helping us to make the New People's Hospital our hospital. Okay.
Well, any closing words you want to leave with the audience before we leave?
Just again to reiterate, in the next coming weeks there will be several fundraising activities, primarily developed by the corporate community, which we are very, very grateful, because in order to continue the services at the level in which the hospital and the clinics are currently providing, as well as to create, develop, champion these fundraisers is quite taxing, and we all know that staff is limited. Right now it's myself and an assistant, and everyone doesn't realize, or some people realize, one employee can only go but so far, because we have to balance work and life.
Though, right?
We have a website. All of that stuff doesn't say. We have the website, www.bvihsa.vg. We have the calls, but I'm trying to give the corporate community such kudos for coming up not only with the fundraising initiatives, but championing it. They've gone out of their way to really, really support and to partner. So,
well, for my young viewers out there, you could just Google health services. And
it'll
come up.
BVIHSA, only excellence counts, will come up.
Okay. So that's good to know, you know, so that people can easily access
The information.
the information.
We have hours, visiting hours, contact detail. We have every single office and department we have there. We have unit heads, extension numbers, whatever you need. We have the services, what they provide. Yeah, you checked. Ah, that's good. That's good to know. Yeah, it has the information there at the click of a button. So just browse it and see what we offer, and then everything coming on new will be added as well. We're here to serve the community. Yeah.
Well, that pretty much wraps up what we're going to be doing tonight.
Great.
Yeah, we were able to put that information out there in the community. Services, has a number of services that they're offering in our community. I even noticed that they're advertising some of the services being offered.
Yes.
Which is a change. A good change.
It's a good change. Good.
Yes.
Good.
Sometimes we know, but we need to be told.
Yeah.
Right?
Sure.
And my profession is I must tell you and then tell you what I told you.
Yes. Yes.
Yes. So all in all, ladies and gentlemen, we had a very good show. We basically did the BVI Health Services Authority tonight, and we had fun. I had Dr. Sneck, Dr. June Samuels, and Franca Potter here with me, and we had a wonderful show. So ladies and gentlemen, at this time, as I usually say, God bless these Virgin Islands, and we'll see you again next week.